Now, if this is the year that you finally decide to take action with treating your eye floaters and you feel that a vitrectomy is what you want to look into, then in this video, I'm going to give you some pretty important tips and questions to get answers to before you make your final decision. Hi, I'm Optometrist Martin Oguzie and this is Martin's Eye Tips. Thank you so much for watching. On this channel, we're all about helping you to see better, see more comfortably, and to be less anxious about your eyes. You can support the channel with your subscription. If you do so as well, please hit that notification bell. That way you'll get reminded every time I upload a brand new video. Now, if you're thinking about getting a vitrectomy done, it's likely to be something that you have to pay for yourself. This is true even in the UK, where most of us are used to free healthcare, and in places that have insurance-based healthcare like the United States, you may well find that your insurance will not cover this procedure. Now, this means that it's entirely up to you to do your own research, as the choice isn't made for you by the National Health Service, or you may not be provided with a list of recommended surgeons by your insurance company. So it's all the more important that you ask the right questions to satisfy yourself that, first of all, you are in safe hands. Secondly, that you know what the risks are. And thirdly, you know what to expect after the surgery. So with these three things in mind, I suggest that you make a short list of clinics and surgeons based on recommendations, and then go into more detail and get the answers to these key questions. So who will be doing the surgery? So this is important to ask because as professionals, that clinician will have their own clinical decision-making process. So if you spend all your time asking that individual questions, and then on the day of your surgery, you find that somebody else is actually doing the surgery, then you may well find that they make slightly different decisions to what you've already discussed. Number 2, how many vitrectomies has my surgeon done? It may be helpful to know how many floater-only vitrectomies they've done, and also the non-floater-only vitrectomies they've also done as well. This question really just helps you to understand the level of experience that they've got with dealing with floaters-only vitrectomies, as well as the general vitrectomies that they may have done while treating other vitreoretinal conditions. Number 3, how many surgeries have they done recently? This just helps you to understand how current their experience is, and also how up-to-date their procedures may well be. Number 4, what are your success rates? So this is important to ask because then it just opens up the discussion to help you to be informed about the risks, and also the number of people that really have things going wrong compared to those who leave satisfied. This may also open up the discussion about what they deem to be a successful outcome. Number 5, what complications can make it unsuccessful? This just helps to open up a discussion about what things can go wrong, and also hopefully helps your surgeon to open up a discussion with you about how they reduce the risk of these things happening. Number 6, what's the benefit of a pars plana vitrectomy? So this question really is just designed to open up a discussion, just to confirm that it is a pars plana vitrectomy that you're having, and just to inform you as well why they think that this is a beneficial way of doing it, and also why it's the gold standard way of doing a vitrectomy. So number 7, do you routinely suggest inducing a posterior vitreous detachment for FOVs? And in this question, your surgeon will then have a discussion with you about their plan and whether their plan includes inducing a posterior vitreous detachment. This is really done when you want to remove all of the vitreous out. This does carry more risk, and it's not really a procedure that I think is really done routinely for FOVs. So it helps to just have that discussion with them. I've seen and heard of some people who have been offered an induced PVD, posterior vitreous detachment, as an option. So it's been left kind of up to them, and presumably they've been informed both ways about it. But usually if it's not indicated, I wouldn't imagine that this would be an option, but at least this opens up that discussion. Number 8, will I be 100% free of floaters post-operatively? So this question really just helps to manage, I think, your expectations, and helps the clinic and the surgeon to be able to discuss that with you. I think personally it may be a bit unrealistic and setting the bar too high to expect 0 floaters whatsoever. You may have 1 or 2 possibly, so at least they can let you know what to expect, and so that your expectations are not crushed if you find that you've got one speck after the operation. Number 9, how long should I allow for the recovery of my vision post-operatively? This question is really just about helping you to make sure you're fully aware of what to expect after the operation in terms of your vision, so that if you have plans to go back to work or do anything that is going to rely on having optimum vision, then you can plan for that if you know what is realistic to expect. Number 10, can you share some of your post-operative patient testimonials for my type of surgery? I think this is a question that many surgeons will anticipate, and there will be testimonials readily available. So you can certainly ask for more, or if you didn't get any in the first place, then this is an opportunity to be able to ask for that. Certainly there should be plenty of these testimonials available for you to access. Now, of course, you should go without saying that you should pose your questions in a non-confrontational way that any reputable clinic and surgeon would have no problems answering if they don't already cover these questions already. Now, keep in mind that these aren't necessarily the only questions that you should ask, but it's a quick guide to the key types of questions that you want to satisfy yourself with. You can get some of the answers on their website, but ideally you want to have a face-to-face conversation with someone to verify some of the answers either before or during the pre-operative assessment, which may be offered by your clinic for free. So let me know in the comment section below if you think there are any helpful questions to ask that I may have missed, and I'm sure anyone considering it will appreciate your suggestions in the comment section below. If you find this video helpful, then I do appreciate your continued support with a like and a share perhaps of this video, and subscription to the channel as well. And if you do that, then please don't forget to hit the notification bell so you get reminded every time I upload a brand new video to the channel. Thank you so much for watching, and I look forward to catching you in the very next video. Take care.